Well, thank you. Thank you very much. It's a real pleasure to be here. I can't think of anything I'd rather do than be at a High Plains Summit for Relay. The emotions run high at these things, and that's one of the greatest things about Relay for Life and relayers is they have the spirit. They have what we need in the American Cancer Society because they bring it to us. And I'm just so thrilled to be here. Well, I'm going to talk a little bit about hope this afternoon, and I just want you to know that it's a very important thing. Where do you keep your hope? It's not just another prop that we keep in a drawer to pull out on relay night or even a little something to keep in our pocket or backpack. Hope is an action verb, and I keep mine in my hands. I'm a radiologist, and I specialize in breast imaging. My job is to find breast cancer early, and I'm a caregiver with hope in my hands. My hope has been very visible as I exercise the privilege of giving back to the women, a number of women who fear breast cancer, or those who have developed breast cancer. My whole career and life has been devoted to the early diagnosis and treatment of breast cancer. And many women over the years, as well as my friends, my family members that I've seen, and colleagues, and even some men have benefited from life-saving mammography. No matter who you are, or when you hear the words, "you have cancer," it strikes fear into your heart. We've heard this many times today. Your imagination takes off, and you think you're the only person this has ever happened to, and you see a very bleak future ahead. But when you hear there is hope, and the doctors take care of this, the doctors can take care of this, you have hope as well. Caregivers come in all shapes and sizes. They're just not medical providers. And we all do not just have hope. We live out hope in all the little things that we do. A caregiver hopes with hands that are gentle enough to brush away a tear, busy enough to do the work of two, steady enough to quiet fears, and dependable enough to always be there when they're needed. A caregiver's love and hope go hand in hand to hold up our loved ones in the fight against cancer. If you are now or have ever been a caregiver for a cancer patient, please stand up and allow us to thank you for your strength, your support, and most of all, your magnificent, mighty, hope-filled hands. Please stand up. Thank you so much for all the care that you have given. Now, I have one other thing to talk about, too, before we go any further, and that's I'm a cancer survivor, and I personally know the other side of the coin in hope. I've told a lot of women and others in their lives that they have cancer, but when I was told that I had cancer, it was really something that I never, ever thought would happen to me. I was in the Cancer Society to make sure nobody had cancer, and I didn't think I'd get cancer. My cancer journey began about 17 years ago. I had some little tingling in my fingers, and I was getting physical therapy for it. And my doctor told me that the tingling wouldn't go away, so he told me that he was going to try me on a new drug that just came out to maybe help some of this because I had some spurs in my neck that was causing this. And that drug was ibuprofen. Strong drug. We know it as Advil. Anyway, he said he had to do some blood work first, and so, well, I did the blood work, and I flunked my blood test, So, and I flunked it because my platelets, and those are the blood cells that start the clotting process in the blood, were too low. And, that was no big deal. I wasn't bleeding or anything like that. I didn't think he thought too much of it. So he said he repeated the test, and sure enough, they still were low. So he got these same results, and he said, well, you need to go see a hematologist about this. So I went to see one of my colleagues, a guy I know real well, because I knew he'd give me special treatment on this. And sure enough, he did. I walked into his office. He said, lie down on the table. I'm going to do a bone marrow on you. So that was really special, I'll tell you. So he said he thought I had this disease called idiopathic thrombocytopenia. What that idiopathic means, we don't know what it causes it. So anyway, he said these people usually have a big spleen, and I knew that from medical school. And so he said, but he couldn't find a big spleen on me, so he sent me to have a sonogram to check it out. So I saw one of my radiology partners in the radiology group that I was in, and he did the testing. And I knew that something was wrong when I was lying there on the table, and they kept sonogramming all over on my left side in the upper outer quadrant here of my abdomen, and they brought in other people to sonogram and look at it. So I said, well, what's going on? He said, well, he said, I'm not sure. I don't think it's anything. It's probably just some normal variation or something. So, but I want you to go have a CT scan and see what it looks like. So I said, okay. So I went over to another office and had a CT scan, and they did the CT scan, and I left after that and said, I'll call back later and see what you guys find out. So I had to go to a meeting off campus, and later that afternoon I was coming back, and I got on my car phone, which was about this big at that time. And so I called him. I said, so what did you figure out from looking at my scan? So there was a pause on the phone, and he said, well, Fillmore, that's my middle name, well, Fillmore, you've got a kidney cancer, and you're going to have to lose your kidney. My eyes got about that big. I was driving the car. I about ran off the road. I was in shock, It hit me like a ton of bricks. And but after the shock, he did give me some hope, I have to admit. He did give me some hope. He said, fortunately, it's small, and we found it early, so I think you're going to be all right. It was small, but it was very aggressive, but I was very lucky. After the surgery, I was away from work for about a month, but I had tremendous support from my family, my friends, and from my ACS family. And I've never forgotten about how important hope is when you hear the words, you have cancer, and how necessary it is for every survivor. Hope works to keep a survivor from stumbling and falling along the cancer journey, because sometimes we have to hand off our hope for someone to hold us until we are strong enough to lift it high again to light the path for others. As survivors face the challenge of each new day, we inspire hope for new patients, our doctors and nurses, and all cancer fighters. If you are a survivor, please stand up and allow us to honor your courage, your determination, and most of all, your beautiful, battle-scarred, hope-filled hands. Please stand up. Thank you. Thank you. You are all heroes of hope because you have lived through this disease and you know what it's like to hear those words. But survivors and caregivers aren't the only ones with hope in our hands. Look at your own hands and see hope in action. Is it hard to visualize? Let me help you out. Look at the hope tattoo that has just been given to you, passed out in the audience there. Please place it in your hands so that you really and truly see and show hope in your hands. I've got one right here in my hand, a hope tattoo. Can you see it? Yeah. Hope is there, right there in your hands, and your hope may carry out those crazy games that you dream up in the wee hours of the morning at relay. Or your hope may light luminaria candles or give a high five to the survivors as they come around the track. The hope in your hands may take the hand of a new team captain or release a balloon in memory of a fighter no longer with us. Don't wait for hope from scientists or physicians or lawmakers, but put it to work today where you live, because hope is in my hands, in your hands, and it is in our hands as we work together to fight cancer. All that you're doing now and all the amazing things you will continue to do, keeping your hands busy building hope into a cure. Thank you so much for letting me visit with you this afternoon. And remember, keep the hope for a cure. Thank you.